Hello, this is Dr. Brian Hill, and here are some video demonstrations to guide you after your distal biceps repair surgery. It is important that if you have any questions, you reach out to us to assist you. After surgery, you will go home with your arm in a splint. This will protect the repair and incision. It is important to keep this dry and avoid getting it wet. You may start moving your fingers right away, however, to limit swelling. In addition, it is important to elevate your arm to limit swelling to the hand as well. At the 2-week follow-up visit, your dressing and splint will be removed. At this point, it is okay to shower with gentle soap and water, no soaking in baths, pools, or a hot tub. We will place a hinged elbow brace that will be locked at 90 degrees, and this will continue to protect the repair. The brace is to be removed for exercises, dressing, and showering. The following exercises you will do 3 to 5 times a day with passive range of motion into flexion, extension, supination, and pronation. It is important that during this time there is no strengthening exercises. For the forearm, supination and pronation, it helps to find a table where you can rest your arm. You will use your other hand to gently stretch your arm to turn your palm towards the ceiling as well as the ground. Icing afterwards can help with discomfort and swelling. In addition, we will work on elbow flexion and extension. Do not force this stretch, but the goal is to slowly gain range of motion. This may be also assisted on a countertop where it keeps your arm level. After 6 weeks, we will discontinue the hinged elbow brace and start formal therapy. The goal is to start gradual strengthening at this point. For further protocol instructions, more information, or to get in touch with us, please visit our website at www.brianhillmd.com. Thank you.